Print servers in federal environments create risk and unnecessary complexity. Every new printer, location, or policy adds strain to infrastructure that was never built for today's demands. FedRAMP High Authorized Printer Logic eliminates print servers with a secure cloud-native, zero-trust solution designed for federal IT. With advanced security, centralized control, and simplified management, agencies can modernize print without added burden. See what secure serverless printing looks like. Visit Vasion.com to learn more.
Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Defense Department is changing how it determines eligibility for transitional healthcare benefits for reserve component service members who are separating from active duty. The change comes after National Guard and Reserve members sued the Pentagon, arguing that the department had added an eligibility requirement that wasn't in the law. Federal News Network's Anastasia Obis is here with more. Anastasia, good to have you.
Hi, Terry.
What exactly is the Pentagon changing here, and why did reservists bring their suit?
Yeah, so Anthony Tata, he is the Undersecretary of Defense for Personnel and Readiness. He issued a memo last week saying that reservists don't have to demonstrate anymore that their period of active duty service is connected in some way to a war, a contingency operation, or a national emergency to qualify for the Transitional Assistance Management Program, or TAMP. TAMP offers 180 days of TRICARE coverage to some service members and their families after their active duty orders end if they were activated for more than 30 days. So when Congress created TAMP in 1991, it was supposed to help service members transition to civilian life, but at the very beginning, it applied to a very narrow group of reservists, and then lawmakers broadened eligibility to better support reservists cycling like on and off active duty. Despite that, in order to be eligible for the benefit, your active duty orders were supposed to be coded as in support of a contingency operation to be able to receive that benefit. Now, what's also changing is that service members who were ineligible for TAMP for the last 6 years can file a claim with the Defense Health Agency, and they will be reimbursed for healthcare-related costs. That would include premiums, and that would include some out-of-pocket expenses they incurred during that time.
Anastasia, how did this become a legal issue? What was the policy that perhaps might not have been in alignment with statute?
Yeah, so earlier this year, a class action lawsuit was brought, and it was challenging the Defense Department policy that conditions eligibility for TAMP. That policy has been in place for a very long time, but the main plaintiff, his name is Anthony Guntars. He argued that Congress designed TAMP to cover reserve component service members during a national emergency, regardless of the type of active duty they perform. So this case is also built on a recent Supreme Court case, the Feliciano versus Department of Transportation, which was issued in 2025. And it had to do, that case had to do with what it meant to say that you were called to active duty pursuant to a national emergency. That case was about differential pay for reservists, but the Supreme Court ruled that reservists do not need to prove that their service was substantively connected to the emergency to get that differential pay. So the plaintiff in that case, to give you an example, the plaintiff in that case, Nick Feliciano, he worked as an air traffic controller, and he was supporting the Coast Guard Reserve by escorting ships during operations Iraqi Freedom and Enduring Freedom. Also, to add to that, the United States has been in a constant state of national emergency since 1979. So as for this case, The plaintiff serves 4 years on active duty. His orders and he gets notified by the Defense Health Agency a month later that he is disenrolled from TRICARE. He contacts Navy Reserve officials, and they basically tell him that his orders were not coded in the Defense Enrollment Eligibility Reporting System, or DEERS, as being in support of a contingency operation. They basically told him, look, normally active duty for special work, active duty for operational support orders do not qualify. So the lawsuit basically says service members are denied coverage based on this internal administrative coding requirement, and that requirement does not appear in the statute.
So has DoD issued a new policy in response to the lawsuit then to clarify this?
So it appears so, because DoD in the new memo addresses the central issue that is raised in the lawsuit. The Undersecretary said that the Assistant Secretary of Defense for Reserve Affairs will ensure coding in the system is adjusted to implement this change to temp eligibility. The main plaintiff, Mr. Gontars, he has already received information that he is eligible, because in addition to the period of active duty that's in the complaint, he's also been on and off active duty since then. And for his most recent active duty, he was told that he is eligible for temp now. Plus, the memo says, like we discussed, that service members who were denied temp benefits can seek reimbursement, but that's on or after April 24th, 2020. And that date basically goes back to exactly when the lawsuit was filed. And the reason for that is that the case was brought under the Administrative Procedure Act, and that has a 6-year statute of limitations. Now, it's important to note that the policy, that's not when the policy first went into effect. So that's clearly in response to this litigation.
Does this resolve the lawsuit? Everybody can get their claim settled and move forward, or are there still issues?
So the attorneys said that they're thrilled by this policy. They agreed to pause the case for 60 days while they figure out whether the new policy addresses all of their claims, but they haven't yet agreed to dismiss the case. One of the attorneys told me that they have a call set up with the government this week, so they're going to be reviewing if there is anything else that needs to be done. But they said that this policy, it's a really big step towards resolving the case.
That's Federal News Network's Anastasia Obis. Anastasia, thanks for bringing us this story. You can find her full story at federalnewsnetwork.com.